World Glaucoma Day, a week rather, in Trinidad and Tobago. Joining us is we have the past president and founding member of the Ophthalmological Society of the West Indies, Dr. Deo Singh, and also the secretary, Dr. Rajrishi Sharma. Welcome.
Thank
So it's a very informative segment. Good morning. So we're talking about Glaucoma Week in Trinidad and Tobago. How do you define glaucoma?
Glaucoma is a disease of the optic nerve that is manifest by degeneration of the nerve and reflected in changes or loss of field of vision, leading to blindness if untreated.
What leads to that degeneration?
There are several factors that make people susceptible. One is a family history, ethnicity. Pigmented races are more at risk. There are secondary glaucomas related to certain drug uses. It is commoner as we grow older.
Wow. And Dr. Sharma, how prevalent is this in Trinidad and Tobago?
There was a study recently, the National Eye Study of Trinidad and Tobago, the NEST study, and of the patients that presented with blindness in that study, approximately 30% was from glaucoma. So extrapolating and from the international glaucoma figures, here in the prevalence in the population, about 7% is what we think. And that's also been supported by the Barbados Eye Study, which was done several years ago.
Okay. Now, Dr. Singh, how exactly does it affect your vision? How serious is it?
How serious is it is underscored by the fact that symptoms of the common form of glaucoma, which is chronic glaucoma, are late in the disease. In other words, this is being described as the silent thief of sight because you lose probably about 50% of your vision before the individual recognizes that there's a problem. The reason is that you lose a little part of your field of vision. And the field of vision of the right eye and the left eye, there's a certain, probably 30% of your field of vision is common to both eyes. So if you lose a little bit in this eye, you don't really recognize it unless it's in the central part of your visual field because it's taken up by the other eye. So the field of vision gradually contracts, and then somewhere along the line the individual recognizes, I'm not seeing so well on my side. I'm almost upon someone or an object before I recognize that it's there. Pain is not a feature of chronic glaucoma. Acute glaucoma, which constitutes a small percentage of the presentation, probably less than 5% actually, of glaucoma is painful, acute glaucoma. But chronic glaucoma is painless. So it is best picked up during the course of a routine examination by an eye care professional.
How often should we get checked?
Because chronic glaucoma tends to manifest in the over 35 age group, it is felt that people over 35 should be checked, should have a routine eye examination. When we're in our 40s, we generally need some help with reading. So we should be being seen by an eye care professional at least every 2 years. When you're over 60, 65, you should have an eye check every year. Part of a routine eye examination includes screening for glaucoma.
I would add to that too, that if you have a family history, so a first degree relative, a parent, brother, sister, then you should be screened perhaps every year. And if you have multiple first degree relatives, then that's even higher risk.
Does glaucoma has anything to do with pressure, build-up of pressure in the eye, or even bleeding?
Pressure. There's a relationship to eye pressure. High eye pressure is one of the risk factors for glaucoma. And I put it that way because...
High blood pressure?
Eye pressure.
Eye pressure?
Yeah. I put it that way because the pressure is not high in all forms of glaucoma. So there are certain other susceptibility factors that makes the optic nerve prone to developing glaucoma damage.
Help me to understand the field of vision. I know you brought a chart here to explain to us this particular, the vision itself.
Yeah. So if you look here, this is someone with a normal field of vision. You're taking in the scenery if you go up to Maracas or wherever. And with glaucoma, because your field becomes contracted, then
you're just limited to
that. Yeah.
That little area, so you're not even seeing the people on that to the end there.
Correct.
Help me to understand in that diagram with the eye, what part is really affected? Where is that particular nerve?
The optic nerve takes off at the back of the eye and transmits visual information to the visual center at the back of the brain. And this picture here is to demonstrate the effect of pressure against the nerve elements in the retina and in the optic nerve.
Can that pressure lead to bleeding eventually?
No, bleeding is not a feature of glaucoma.
Okay.
Yeah. We do have very unusual cases of glaucoma associated with abnormal blood vessels in the front compartment of the eye, but bleeding is not a feature. That is more a feature of diabetic eye disease.
Oh, okay. Now, Dr. Sharma, how aware are we of glaucoma, and are we taking whatever necessary steps that we need to?
On years on end, OSWE has tried to raise the awareness of glaucoma. We do this by having various interactions in the media and screening events and so on. I don't think we're at the level where enough people know how serious a condition this can be, as we still see lots of patients presenting in clinics with reduced vision and advanced stages of the disease. And when asked, they didn't know that this was a condition that they can have. What will also help to get the word out there is that people with glaucoma tell relatives and friends and so on, because what you tend to find as well is that when you take a history from patients that present, they do come back and for follow-up reporting that they do have friends and relatives with glaucoma, but it was never mentioned because they didn't want anybody to know. They felt embarrassed having a chronic condition or something like that. So I think the more we talk about it and the more we get the word out there, the better the awareness will be, and that's what we're endeavoring to do.
Now, Dr. Singh mentioned that it's a silent thief of sight. How preventable is it?
Preventable, as in preventing loss of sight. If you have the condition and it's detected early, there are very good treatments available that will prevent you losing your sight or getting to the advanced stages where you have visual handicap. But the key is to pick it up. We can't stop people getting it, and we can't cure it, but we can control it as best we can with lots of different techniques, from simple medications such as eye drops right up to surgery.
Okay.
And so it depends on how early we get you and how aggressive your condition is behaving as to where in that treatment ladder you will be. But the key has to be to get people screened and diagnosed early to prevent them losing their sight in the first place, because of course once you lose it, there's no way to get it back.
Wow. And Dr. Singh, what are your closing comments, and also what is on the agenda for World Glaucoma Week in Trinidad and Tobago?
So, an entire week is devoted to this event of raising awareness about glaucoma because of the significance and of glaucoma worldwide. It's a leading cause of blindness. In terms of, so the message should be: take action, get tested, prevent blindness. And in that regard, there are screening events that are being done by colleagues individually, not only in Trinidad, but our colleagues throughout the Caribbean and worldwide. In Trinidad also there's a screening throughout this week at the optometry clinic in UWI and at various health centers.
All right.